Hello, I am Dr. Kara Olson, and I really wanted to share a story with you today about a patient that I had seen this week. It's just so common, it happens so much. In fact, I had 3 patients ask me this week about this question. I really wanted to address it just so more than 3 people have the answers that they're looking for. I had a friend of mine tell me that they had one of their friends had a serious accident. I had a patient of mine tell me they've been trying to get this friend of theirs to come in and see me for quite some time. And the other day I saw him as a new patient. It was about 3.5 months after his accident, and a very serious accident. He was hit very hard, over 50 miles an hour, and he was feeling a little stiff and sore, went to the emergency room, got some anti-inflammatories, some icing instructions, and some pain relievers, and went home and really hoped that things got better. The next week he had trouble kind of seeing, not blurry, not can't see, but just has to blink a lot or maybe bring things a little bit closer, so could be under the radar. You could kind of fluff it off, kind of change in vision. But then he also had difficulty sleeping and a lot of fatigue. So yeah, he had a stiff neck, but his main symptom was really fatigue. We decided to take some x-rays, and we saw something very serious. You have 2 little ligaments right up here behind the ears. And even if you're hit at a very high mile per hour and you get jarred, a lot of patients didn't feel so bad. You've got your adrenaline going. Some people kind of freeze. When you're stressed, you could fight, flight, or freeze. Some people want to run and they get really jerky or they move a lot, and some just kind of stare. So almost nobody takes into account the patient's position during the accident. If you're turned and looking, if you're screaming and upset, you're going to have a completely different anatomical response. And a lot of times the patient doesn't know exactly what was going on in that moment that they were hit. So I'd like to show you a video on some of the ligament trouble that we see. We have a computer simulator, and on x-ray, what we do is we take special x-rays at my office where we have you look down, and you can actually get an image of how the ligaments have been torn, and then we can get a pretty good idea of what's going on. Now, that is a picture of that same joint, which is right behind the ears, and a person kind of going like this. Now, a lot of times it's not the amount that the head moves when they get whiplash, but it's the speed. So I want you to think of it this way. If you have a rubber band and you're going to pull it, if you pull it nice and slow, the rubber band's probably going to be just fine. But if you quickly rip on it, the probabilities of there being a tear in the rubber band go up way more than 80%. So I have these conversations a lot with my patients, and this one in particular, I really wanted to share because in 3 short months, this patient has had anxiety attacks, bowel disturbances, can't eat, doesn't really have an appetite, is starting to not be able to function at their job, and really he has kids to take care of and a wife to take care of at home because she is on disability, and he's having a very difficult time. So there's a lot of people that depend on him, and it's difficult sometimes to sit back and get care for yourself, or maybe want to make waves or take the time out to have it addressed. However, I have to commend this patient, for being as skeptical as they were. They came in, got the care. We were able to find this type of ligament injury, and we're saving him way more time and hassle. He's been able to go back to work. We have the therapy tape. There's a lot of different treatments out there, but a lot of people have seen the muscle taping, which is just phenomenal. I mean, we've got great tools other than anti-inflammatories and painkillers nowadays, which are very much part of the healing process, dealing with the pain and having some pain relief, allows you to sleep. It allows you to go through life as you're healing. But you're going to heal one way or the other. You're going to heal crooked and kind of compensated, because the body will work around an injury and then it will form solidly that way. I like to use the analogy of a tree. You know, not every tree grows straight. Sometimes they get turned, and then there's a knot in that tree that tree deals with for the rest of its life. If we, you know, tie up nice supports, get a nice stick, right, and they tie it up on each side, then the tree has a chance of growing back to normal. And really, you have a decision. Do you want to heal crooked and kind of deal with that, or get it right the first time? And I'm lazy. I don't like a lot of work. I like to get it right the first time. It's an amazing job that I have to get to help people with this. The majority of patients, unfortunately, don't come in. You know, it's they work till 6. They're doing way too much. They got kids. They're afraid of bringing their kids in. They don't know how to juggle the appointment times. And what happens is they push through it. And the original injuries and the state of the body is able to compensate, so they get away with that. Sometimes all the way up for a year to 5 years, depending on how mild or severe that whiplash was. But 5 years down the road, we see whiplash on x-ray, and it's not pretty. So I would like to show you my x-rays. This is my office where I have my x-rays. I'm going to share them with you. So that's my neck, and it looks pretty good. I got a nice curve, I got some nice space, and I will have you know that with my snowboard instructor days in college and all these wonderful things that I do, hitting my head, skiing, surfing, I've had well over 50 whiplashes, minor and major. And a couple years ago, I had a very light fender bender, about 35 miles an hour, at a stoplight, and I did exactly what I'm telling you guys not to do. I had a doctor who was hit head on, and he lost his arm for about a year, and he had to regenerate it, and so I worked overtime filling in for 2 practices, and I taped up my neck and went to work and didn't have my partner to take care of me and adjust me. So I got about half the amount of treatments I needed. I didn't get 0, but this is my same neck looking up. And I would like to share with you my little problem. I've got these 3 little vertebrae that are sliding back. And the problem with that is my spinal cord sits right here. So these are wiggling, all 3 of these, near my spinal cord, which is extremely serious. And I will now have to get a more serious therapy or ignore it. The serious therapy is Prolo. So they're going to go in and inject some salt water into my neck so that it can stabilize. And then this time, I have to be good, get my adjustments, get my alignments, and take care of my neck. Or if I don't, it's not going to look so good. So we have all heard joint degeneration and arthritis. And if you Google it, it says it's normal. And I would really like to explain that. Only about 8% of the population goes to see a chiropractor, so that means 92% of people never get adjusted. Okay, so I'm just going to pause a minute, and I want you to imagine if you've never brushed your teeth, ever. Never brushed your teeth your whole life. So most people's spines have 0 bone health, and this is this creates a statistic that it is pretty normal for people to have arthritis. Arthro means joint. Itis means inflammation of. So if I have that whiplash in there, my vertebra keeps moving like I just showed you, it's going to create friction and it's going to swell in the arthro, which is arthritis, especially if I eat junk food. Okay, when we're not feeling well, we go lay on the couch, watch our favorite show, eat some junk food, it just flares the inflammation process up. So I'm really looking forward to teaching more about this. I really want people to know about whiplash, whether it's minor, like my recent car accident, or whether you've had something major. Why not check it out? We're talking about an hour to save tons of hassle in the future, because it doesn't look good if you leave it. So I'm going to end this video with a video, and I'm going to show you a degenerative cervical spine. So that shows you over time, as you keep frictioning and there's too much movement in there, how the bone can grow extra bone. It's going to show you how it can go in and pinch the nerve. We have a lot of terms for this. There's stenosis, bone spurring, DJD, arthritis. They all mean the same thing. They're just different severities of it, and one is more medical and one is less medical. And I would really love to see the future generations not have to deal with this like we see with our patients now every day. Every day I have new patients come in that had fender benders, auto accidents, fell out of a tree, fell snowboarding, my skiers who hit hard, and some of them that hit their tailbone and didn't realize their tailbone hurt so bad they didn't know they flung their head. People at work that fell off a chair. We all go through this, and I urge you not to have an injury collection and take care of this. It's been a pleasure teaching you today, and I look forward to you telling all of your friends this story, as exciting as it was, and make sure you don't get an injury collection.